Hey everyone, if you or a loved one has been diagnosed with osteopenia or osteoporosis, meaning low bone mineral density, and you're concerned about weakening legs and your fall risk, this week's video should be particularly helpful. I go over some simple exercises that can be performed in the home to strengthen the legs, decrease fall risk, and prevent potential fractures down the road. I hope you found the video very helpful, and be sure to hit the subscribe button for more informational videos regarding physical therapy and how they can improve your life. Osteoarthritis is more common in women than men, affecting 1 out of 3 above the age of 50. It primarily occurs in the hips and the spine, and resistance training has been found to be very effective in improving overall bone health, and that's what I'll be covering today. For these exercises, all you're going to need is a strong chair. If you find them easy, you can use some form of resistance, such as dumbbells around the home, fluid-filled water bottles, soup cans, sacks of beans or sacks of anything that you have, sacks of rice, anything that can serve as an extra weight. You don't necessarily need to go out and buy some dumbbells. So in working on exercises to protect your bones and to manage osteoporosis, we would work on large muscle groups that surround the areas that are most common to experience osteoporosis. Again, the hips and the spine. So the first exercise is a simple sit to stand. Now, if you need to use the armrests or your chair in the beginning to push up, that's fine, but try to progress to the point where you can do it with no hands. I like to cross my hands in front and come up and come down slowly. Remember, that's where the majority of strength is built. And with osteoporosis, we're going to be very careful to come down into our chair softly and gently to help to prevent a compression fracture. So again, feet shoulder width apart, coming down slowly. The up can be faster. Working on sets of 10 to 15 reps, depending on your tolerance when you start. 2 sets, twice a day. You want to wear good footwear for this, so athletic shoes. If you're getting worried about this position, I'd recommend doing these exercises next to the sink, so you have something stable to hold on to. Also, having a chair behind you, like I have, is another great way to add extra safety and stability to this exercise. Hip abduction, kicking to the side. If you're finding kicking all on one side is too advanced, you can alternate that. And then progress as you go from alternating to isolating, or from going side to side to keeping it all on one side. Hip extension, kicking straight back. Hamstring curls, so again, holding on to something for stability if needed. Another exercise I would incorporate, which is nothing to do with the lower body, but just something more for those of you who are suffering from osteoporosis, to strengthen the upper body so it's more functional and it helps more with daily life. So come up to a wall and work on a wall push-up. Just coming in and coming out. If this is feeling too easy, you can do a standard push-up, but this may be more appropriate if you're at the level in your life where you're dealing with osteoporosis. And finally, heel and toe raises. Just raising forward and back, forward and back. Now with osteoporosis, there are 3 things you should never do. The first being to not twist at the spine. Compression fractures are a common injury with osteoporosis and very painful and difficult to treat. So do not twist your spine, especially while lifting. I've seen quite a few injuries over the years in this position. Second is to not fall into your chair. As someone's getting older and may have the diagnosis of osteoporosis, most likely the legs might be a bit weak. And so rather than controlling a nice sit like you always have throughout your life, starting to plop into the chair becomes much more common. And that plopping, especially when coming down to a firm surface, can result in a compression fracture. Third and finally, to not bend forward at the waist. Again, especially while lifting something. So when lifting, do not bend forward like this. That's just way too much stress on the spine. But instead, lift with good form. Either here for the squat lift or the golfer's lift by bringing one leg up and stabilizing with your upper body. This week's video has been all about what are some simple and easy exercises that can be performed in the home to strengthen your legs, decrease your fall risk, and potentially prevent future fractures. But there are so many different topics I could post about. It all just depends on what you guys would like to see. So post your comments below and subscribe so I can do my best to create a meaningful video for you or a loved one to improve your life. This is Dr. John Mayo, physical therapist, really hoping that this program has been helpful for you or a loved one and improves your life.